Hello, I'm Kate Charlesworth. I'm a public health physician in Sydney, and I'm a sustainability lead within the New South Wales public health system. As a hospital doctor in my early years, you see a lot of preventable illness. You see a lot of the diabetics that are on the renal ward, the respiratory ward is full of people who are smokers. So I quite quickly became interested in those bigger picture health issues of alcohol and tobacco control and obesity and those sorts of things. And then, of course, I became interested in climate change, which is the biggest health issue of them all. And so that's now where I work in climate change and climate risk and sustainability. I wouldn't say that there was one most valuable skill that I've possessed. It's more that public health physicians have a range of skills. So we obviously have the clinical background and clinical experience, so we can talk to that. But then we have training in, public health medicine training includes, epidemiology, infectious diseases and other things. Yeah, so I think that diversity of skills that public health physicians have is really one of our most important attributes. Yeah, so I think that probably the biggest opportunity that I've had in my career is that I did a lot of my advanced training in the UK. And I was lucky enough to have the opportunity to work at a new national unit that was setting up within the NHS. And this unit was tasked with decarbonising the whole of the NHS. And that was a small unit, but extraordinarily effective, and some really forward-thinking people in that. So that really shaped my career direction, and that's the sort of direction that I've pursued since I've come home. Yeah, I think personally a particular challenge was the year that I did my fellowship exam. I had a baby and a toddler and then was starting a PhD. But, these things pass. You get through your exam, your children grow up a bit and become more independent, and you get through a PhD. So it's a sacrifice at the time, but they're worthwhile things to have done in the longer term. But I think more broadly in terms of challenges in my space, there's a huge, frustration, there's overwhelming scientific evidence that we're facing climate breakdown. So I think there's a number of worthwhile steps the college has taken on climate change and health and sustainable healthcare. So for instance, the college has divested from fossil fuels. We have a number of position statements about climate impacts and low carbon healthcare. And we support, evidence-based and prudent initiatives to decarbonise the system and to decarbonise healthcare, which I think are really useful contributions to this space. So my advice to trainees is to take every opportunity that is available to you. There's opportunities to work elsewhere, to work overseas or in remote or regional areas, to do different pieces of research. You should take those because they will contribute to you being a much better rounded fellow in the future. Okay, so I think that one of the most useful things that I or people like me have done is that we've had training overseas and we've seen different perspectives and the way that things are heading, in my area of climate risk and sustainability, for example. And then we've brought that skills and knowledge home and we're trying to make an impact here. So if I've had any impact in raising the profile of climate change and health in Australia, then I think that will have been a useful contribution. I would really love my legacy to be a useful contribution to a net zero health service. So there is now overwhelming scientific evidence that we need to rapidly decarbonise. Every sector is going to have to do that. The health sector has a massive carbon footprint, and so we have a particular responsibility to get our own house in order. And the good news story is that a net zero health service and net zero society would mean cleaner air, greener and cooler cities, healthier diets, more connected communities and so on. So there'd be so many health benefits from climate action.